Hello friends, I'm Dr. Saurav Arora and you're listening to a podcast on health, homeopathy and research. And today's podcast is a homeopathic Materia Medica clinical tip. This tip revolves around the eye symptoms of two important remedies, that is Physostigma and Ruta. Being clinicians, many of us we use these two remedies, Physostigma and Ruta, for various eye complaints, including some non-verified claims of refractory error corrections. But I think we might not be exploring the in-depth use of these remedies in eye complaints. These are very common remedies. You can find these remedies in homeopathic pharmacopoeia of almost every country. These are readily available on the homeopathic pharmacies. Safe, but the need of ours is to explore the in-depth use of these remedies. Now, if I talk of the classical symptoms of Physostigma, which as described in Materia Medica, it is used for night blindness. Now the concept says that night blindness is due to vitamin A deficiency. So is Physostigma going to cure vitamin A deficiency? No, absolutely not. But it is going to alleviate the symptoms of night blindness and help the patient recover from this condition along with the necessary vitamin correction. There is photophobia. There are contractions of pupils. Now here you should compare the remedy Belladonna. There is twitching of ocular muscles, which at times is the main presenting complaint for the use of Physostigma. So if you encounter these group of symptoms, do consider giving Physostigma. Both Physostigma and Ruta are used for poor accommodation symptom of the eye. The Physostigma has paresis of accommodation with astigmatism, especially post-diphtheria. Whereas if we compare with the Ruta, it has disturbances of the accommodation, especially after overuse of eye muscles. For example, in today's scenario, you can very well relate that after too much reading, screen usage, watching TV, there is poor accommodation and overuse of eye muscles. Ruta can be one of the good remedies in such conditions. In Physostigma, there is a spasm of the ciliary muscles with irritability after using eyes, which is comparable to Ruta. Ruta too has pain and heaviness in the eyes after prolonged use of muscles, as we discussed just now. The differentiating point can be the intensity. Ruta has intense symptoms such as strain, followed by a headache, red eye from swaying or reading fine prints. The comparable remedies would be Netramur and Argentum nitricum. There are weary pains after reading, deep pressure in orbits. The tarsal cartilage feels bruised. So it's a clear-cut case of asthenopia. Physostigma and Ruta both are used in clinical practice for increasing myopia. But I have never seen any patient being cured of myopia or the hypermetropia. Certainly these remedies are used only to control the increasing refractory error. This usually happens when there is associated ciliary muscle weakness. If the symptom is appended with a headache, the preferred remedy is Ruta, otherwise it is Physostigma. So whenever a patient comes to you and asks, I want to get rid of my glasses, it is not possible, but yes, we can control the increasing refractory errors with the remedies with these indications. If there is intense headache, ciliary muscle weakness, do consider giving Ruta. If there is no cause, do consider giving Physostigma. If there is a pressure over eyebrows, it points towards Ruta. Whereas if there is an inability to fully close the eyelids, that is like ophthalmos, it points towards Physostigma. Now here you should compare the gelsemium, which is due to muscle lag, weakness. Physostigma is very applicable remedy for floaters. Now this is very common problem in patients and population. These are usually associated with flashes of light and astigmatism. In many cases, the floater issue can be tackled very easily by using this remedy in moderate doses. I've seen that. Obviously, it may not be cured fully, but to a large extent the floaters can be controlled using these remedies. Now both the remedies are of plant origin, therefore majority of the time they are prescribed in repeated doses. But one must be aware regarding non-judicial use of these. So I request my listeners not to take this as medical advice. Go to your physician, go to a homeopath. If you have eye complaint, do visit them. Don't experiment or self-medicate yourself. But yes, for the listeners who are already homeopaths, do try these remedies in moderate doses. If you have any query, any question on the dosage, potency, the repetition, do let me know. Get in touch. I'll be happy to help you. So stay connected.